When you become ill, the whole notion of telling your story actually becomes kind of intensified. Because when serious sickness or injury strikes and your body or mind breaks down, the vital questions are the same. What is your understanding of the situation and its potential outcomes? What are your fears and what are your hopes? What are the trade-offs you're willing to make and not willing to make? And what is the course of action that best serves this understanding? Now, these are all really important questions, and they're important questions that we get to by telling our stories, by understanding and being able to communicate those stories.
So I had to go in to see a neurologist for a nerve conduction study. And so finally, the doctor says to me, you know, how bad is it for you? What, you know, how do you, whatever. And I wasn't sure if he was talking about the shock or my neuropathy. And I said, well, it's changed my gait. A little word, G-A-I-T, it means the way you walk. And he stopped for a moment, and I know there was a little silence, and I had a little relief from the shocks. And he said, what do you do for a living? And my mouth sort of fell open, and this time not from the shock, but just the idea that you're asking me that because I used a 4-letter word instead of saying, well, it's because of the way I sometimes step unevenly or whatever, I used the word gait. And I wasn't using it for him, I used it because I knew the word. And it changed the conversation. And my point here is simply, we don't have to be doctors and we don't have to be specialists, but we need to learn a little of the language of the whatever disease you're working with, because you need to be able to not only to understand what they're saying, but for them to understand that you know a little of what you're saying.
When we speak, we are afraid our words will not be heard or welcomed. But when we are silent, we are still afraid, so it is better to speak. And I thought that was a pretty powerful statement, because so many times, particularly when you're in a health situation, you are kind of afraid to speak. You're afraid to say something. You're afraid to tell somebody what matters to you. But I think it's really important not to be afraid to speak and to sort of empower yourself in that way.
A phenomenal respiratory therapist named Bunny who took one look at me with the brochure on how to take your have a tracheotomy at home, and which was still sitting on my bed, took one look at me and said, oh honey, let's talk. So what do you want? And I said, go home with this. And she said, of course you don't. Bunny was the one person I could finally communicate with. And the difference was she looked at me. And I have to say, it also was helpful that I could actually say, here's what I want. And I make that point because there are many times as a patient, we haven't had a chance to think about what we want, to really think about our values, our needs, our desires, what our family wants, what's more important than something else. We haven't always thought through that as well as we wish we could. And so one thing that taught me is, what do I need to do now when I'm not in illness to make sure I'm clear about quality of life versus length of life. I'm clear about what's important to me if I get very sick, who I want around me, and what really matters to me, so that I can do, I think, one of the most important things we can give as patients, say what we want.
If you think about it, when you're in a treatment plan, it's so important to think about where you are in your life, what matters to you then, what your goals are, what your values are, what you want. And that's been kind of left out for a long time in the discussion. And the way you get at that sense of what matters to you is really to tell your story.
We need to take a step back and just create a space for the community and the patients just to have their voices heard. We're trying to push that heavy rock upstream so quickly so that the researchers can hear what we hear every day, because we're in the trenches with you all. We are there. I don't do cancer research without thinking about my mother. It does not fail me every single time to just try not to break out in tears. And so we don't do this work void of our lived experiences. And then we want to bring that lived experience to our researchers. We have to create a space for the patients' voices to just be heard.
We all face these things every day, but it isn't really until you have a serious illness or you're confronting a real crisis that you really think about what matters the most in your life. Illness intensifies the routine drives to recognize the self. It is when we are ill that one has to decide how valuable life is, which relationships are most meaningful, and what terrors or comfort life holds. We each do have a unique and powerful story, and it's our story, and it's important, and we should never forget that.